Well, good afternoon, everyone. Everybody good? So it's been over 4 months since I declared an ongoing state of emergency here in the great city of Richmond. Currently, the city is in phase 3 of Fort Virginia, the governor's reopening plan. And obviously, if you have any questions, we ask that you continue to visit rvastrong.org/reopening guidance. This guidance is for those businesses that you patronize and also for the business as well. The city government offices and facilities are in phase 3 of operations as well. You can learn how to safely receive any city service at richmondgov.com/COVID19. There you'll find an updated list of the city's operations to date. As of this morning, Richmond City Health District is reporting 2,857 cases in the city of Richmond. There have been 32 positive cases in the city of Richmond's workforce, in our city government, and 38 Richmond residents have lost their life to the novel coronavirus, COVID-19. As we always do at these briefings, I'd like us to all take a moment of silence in remembrance of those who we've lost to this disease. Thank you. The city of Richmond continues to rely on our box it in strategy, regardless of the phase. Regardless of what phase we are of reopening. It relies on 3 vital steps: testing, tracing, and isolating. On the testing front, community testing events continue to be available to the broad public, regardless of insurance status, citizen status, mobility, or geographic location. And if it will make you or your family or your coworkers more comfortable, we continue to suggest that you get tested. I've been tested 4 times and likely will have to do it again over the course of the next few months because of the work that I do. And I want to make sure that not only am I safe, but I'm also keeping others safe as well. So it's my hope that folks take full advantage of the testing that we have available. The testing we do have available is obviously continue to be ongoing. We had 2 testing events next week. Tuesday, August 4th at Fairfield Middle School from 9 to 11, and Friday, August 7th at Hotchkiss Field Community Center from 9 to 11. Those are AMs, 9 to 11 a.m. Also, I want to add that our safety net provider network has also come together to provide ample testing options as well. I want to recognize the Health Brigade for offering free testing every Saturday in August. No registration there required. Daily Planet Health Services test patients all weekdays at their COVID assessment center. And for more information about these testing opportunities, I ask the public to still use rvastrong.org at rvastrong.org/testing. And please know, you shouldn't avoid getting tested because you wouldn't know what to do about a positive diagnosis. It's not a reason that's not a reason to not get tested. Those who test positive at community testing events coordinated by the health district will benefit from safety net or primary care support if they are under or uninsured, and supported isolation if they require it. So all these tools are at your disposal if you choose to come out and get tested and you need the support to get through this pandemic. If you test positive, we'll be there to support you and point you down a road of recovery for you and the safety of your loved ones. That is our commitment as a community. That's our commitment to the health district and the city of Richmond working together. Dr. Avula is not with us today, but we have been blessed with the presence of Dr. Melissa Verray of the Richmond City Health District. She's here to provide some details on the public health status of the city of Richmond. So I'm going to ask Dr. Verre to come up and give a few comments. Dr. Verre.
Thank you, Mayor Stoney. Just a few comments, just a few updates from the public health sector in terms of what's been going on both in the state and locally from the coronavirus end of things. One first is that in the statewide, the Virginia Department of Health has released an interim or early report on work being done to estimate the proportion of adults out in the community who have been infected and have antibodies to the COVID-19 virus. We've not yet completed enrollment of the study, but early analysis estimate that only 2.4% of adults in Virginia have had antibodies to COVID-19. And in the central region, which includes us, only 3%. While this is good news, as this suggests that we are doing a good job of community mitigation and preventing transmission, this means that it's critical that we continue social distancing and other efforts to prevent spread to the large number of still vulnerable people in our community. As Mayor Stoney mentioned, we continue to monitor trends here in Richmond City and in the metro region. Regarding trends in infection, we as a state, we haven't been seeing what the rest of the nation has seen in terms of upsurges in cases, and certainly we in the Richmond area haven't seen what other parts of the state have seen. But we are beginning to see upticks in other parts of the state. You may have heard that the governor has reinstated mitigation restrictions, meaning limiting gathering size restrictions, banning on-site alcohol consumption after 10 p.m. on the Eastern Shore to try and contain increases in activity that we've been seeing out there. Here in Richmond, we are also beginning to see suggestions that we are increasing in our infection rates. Our investigators are hearing about more activities regarding reopening, such as group gatherings, funerals, weddings, religious services, restaurants, similar exposures that tell us that people are getting out more often. And I think it's critically important to reemphasize that we need to do this safely. For us, what we experience here in Richmond, our ability to reopen and to stay open depends on our community's ability to do it safely. And so we need to continue to make safe choices, continue social distancing, wear face coverings, and continue all of those safe habits that are going to keep us all safe. One last update that I'll provide is that the health district also continues to receive and follow up on complaints regarding failures to follow the community mitigation regulations that are still in force. So, for example, the order to require public-facing employees in retail establishments to wear face coverings. As of Tuesday evening in Richmond and Henrico, we have investigated more than 1,900 complaints across both localities. We take these complaints very seriously, but we understand that these constraints for businesses and for retail establishments are new. We understand that everybody is trying to figure out the right way to do it. And so when we reach out, we will start with an educational or a consultative lens to say, how can we help you to comply better with these regulations? If we find that multiple complaints are coming in about the same facility, or we are finding that there is frank non-compliance on investigation, we may need to go to an in-person visit or beyond that to further regulatory enforcement. And then individuals who wish to report a non-compliance event should report by phone at 877-ASK-VDH3 or their online portal that's available on the Virginia Department of Health website. And I will pass it back to Mayor Stoney. Thank you.
I just want to add to Dr. Verre's comments. As she stated, that she's fielded a number of complaints. The health district fielded a number of complaints. And it goes without saying that we must remain vigilant. It has been 4 months, and I know how annoying it is to some of us, but it is very important that we continue to adhere to the guidelines that have been laid out by the CDC and also by the governor. And I don't want to, I don't think you can reiterate too many times what phase 3 means to our community. It means that all gatherings of any kind, social or faith-based, indoors, 250 people. That's the max. 250 people. Obviously, we need you to space 6 feet apart when you're in church, just like you all here at the media are today. Restaurants are open, indoors, outdoors, but still the spacing does matter. We also obviously want those who work there and those who patronize these places to wear a mask. This is the key for us to continue to stay in phase 3. It's the key for us to just redeem a modicum of normalcy, of freedom that we had prior to the pandemic striking the city of Richmond. For fitness and exercise facilities, establishments can open at 75% occupancy. Indoor and outdoor swimming pools, both 75% of capacity. Obviously, still wash your hands, watch your distance, wear your mask, the 3 W's. Very, very, very simple. And when we do that, we will have the ability to stay in phase 3, still continue to go to places, still be able to live a semi-normal life, but it's the new normal that we must live with today. And I know without a doubt that this city, the people I know in this great city, that we can do our part. As I've stated before, I sound like a broken record. This is the greatest team project of our time. Never seen anything like it before. May not live to see anything like it again, but we got to do our part, okay? I want to also end today with some more COVID-19 updates, but this time on the economic front. Some of the economic supports in the wake of the damage of COVID-19. We know what the cost have been to a number of our businesses around our community. We know a lot of folks have been holding on, they've been patient, they've been vigilant as well. And we want to thank them because we know that it's been very, very difficult for them to keep the doors open or even pay their employees. You know, the Economic Development Authority approved over $900,000 in loans to local businesses through the Richmond Small Business Disaster Loan Program. Today, I am happy to announce that the EDA, the Economic Development Authority, has approved the use of CARES Act funding to convert those loans, $900,000 worth of loans, into grants. So those businesses who have already successfully applied for a Richmond Small Business Disaster Loan will no longer have to pay back that loan. This is made possible in the city's allocation of $1 million in CARES Act funding for this desired purpose. The city's Department of Economic Development is reaching out to all borrowers in the program and making them aware of this change. And this is a significant change. Now, I've always believed that small businesses is one of the most courageous things you can do is open up your own business, hang your own shingle. Bravest, most courageous thing you can do. And I know there are a lot of these businesses that have families and individuals depending upon them. And this right here is a help, just a little help from the city of Richmond to ensure that they can go to bed tonight with less stress of paying back a loan and ensuring that they can meet the payroll for those employees and families. You know, the money is going right back into Richmond's economy, keeping workers on the payroll and supporting the small businesses that make our city such a unique economic hub. And my many thanks to the Economic Development Authority, the key members of my administration for making this whole thing happen. I'm grateful for their work. Today, I'm joined by Leonard Sledge, who's the director of the Economic Development Division Agency in city government, and he's here to answer any questions that you all may have with the media on this specific initiative. So with that, we will take some questions.
Henry. Could you walk us through, just so that we know about this money, was this money, federal money, are you all going to pay it back, or how does the mechanics of that work?
I'll have Leonard come up front.
Good afternoon, everyone. Thank you for the question. In April, at the onset of the COVID-19 pandemic, the Economic Development Authority took an important step in terms of appropriating $1 million of its cash on hand to be able to stand up the Small Business Disaster Loan Program. And we were fortunate to be able to make 48 loans in excess of $900,000 to businesses, small businesses here in the city of Richmond, to assist them with helping to keep employees on payroll. The reason why we were able to forgive the loans now is, as the mayor stated, using a portion of the CARES Act funding that the city received. And also, to the mayor's point, we will start reaching out to those businesses starting today and through next week to let them know. We are giving them the option of converting it, understanding that there may be some tax implications. We just don't want to blindly say, here you go, but we want them to have the opportunity, again, just to make sure that it's going to be in their best interest to do so. But when we started this program, as a reminder, the program started out with a 6-month deferred payment with 0% interest, because the EDA and the city, the administration, the mayor, we were very intent on doing all we could to support businesses in the city.
Thank you, Leonard.
Sean?
Yeah, Mayor, I'd like to ask about the incident earlier this morning at around the Lee statue. I was wondering why, after weeks of not clearing the weeks of police not arresting protesters for violating the overnight law, did they change course today? And do you support the move to clear the area around the statue of the encampments and the other things that we?
So the question was about the incident that occurred this morning at the Circle, where yesterday, or I think 24 or 48 hours prior, a task force of health and law enforcement agencies, alongside other government entities, gave notification to those who have gathered at the Circle of some things that were brought to our attention that were considered public safety or public health hazards. Today, that task force arrived on site to rectify that, to ensure that these items were brought into compliance. I do agree with that. I think, we want, obviously, folks to express their First Amendment rights, but we also need compliance when it comes to public health and public safety matters as well. And so you had there, I believe Richmond City Health District, I believe taxation, fire, RPD, other agencies collectively there to ensure that issues were brought into compliance. And also I'll add as well that this is not the first time that they've made this appearance at the Circle.
And do you know what legal instrument was used to clear the area of the encampments? Was it a summons, eviction, and do you know which state and city codes would have been violated?
We've received a number of complaints over the course of the last few six weeks, I guess you can say. Well, for many, many weeks. And this is just a response to what we've been hearing from the community and what some have seen with their own two eyes, of whether it's use of electricity, encampments, things of that nature, a whole host of issues that obviously are out of code here in the city of Richmond. And so there was just a way for us to rectify, make sure that the situation was brought into compliance.
Sean, it's our expectation
Yeah, yeah. The police department will be providing further details of the incidents that occurred there this morning, and so you will have that in your inbox soon enough.
Brendan?
Can I ask Dr. Bray, to put in perspective, the 3% of adults who have COVID-19 antibodies in Central Virginia versus the 2.4% of adults in Virginia? Is that a lot, or is it less than you expected?
So I believe, if I heard correctly, I believe the question was putting that 3% into context, right? In terms of compared to the 2.4% we're seeing across Virginia, what does that 3% mean? Okay. What I would say is these are early findings, and when you look into the details, they need to do more to get more central region representation. So I think there's more to come. Overall, I'm not surprised to see that where we have urban areas, we may see a little more antibody positivity. I think overall, the numbers are happily lower than I expected overall. I think this is not too dissimilar from what they saw in New York City when they did this, or even lower than what they were seeing in New York City when they did this in New York City. And I am happy that it's lower than I expected. I am not surprised that it's a little bit higher, but it's not different enough with as early as these findings are to really make much out of it yet. Just an overall that these are low, and that is good. But a cautionary tale to not let it get higher.
Alex?
Mayor Stoney, so close to 2,000 complaints in Richmond and Henrico. I've looked at the data. There are a lot of businesses that do have multiple complaints, some of them like up to 9 complaints on one business. And when I checked last week, Dr. Abdullah told me that they haven't suspended any permits. And he explained that, you start with education. But really my question is, it's been 4 months, and I guess, Mayor Stoney, I'm wondering, do you think that VDH is kind of being too easy on these businesses that have multiple complaints? People are told, if you don't see people following the rules, report them. But, no businesses have, had their licenses suspended. Do you think they're being too easy on businesses?
You want to?
I'm happy to make a prelim comment, but I know she directed it at you.
Preliminary, yes.
I will, again, I do think it's important to note that we have been seeing, we have a number of complaints, I agree. And I think it is important that we do examine each of these to make sure that when there's a complaint, that people fully understand the nature of the complaint. For example, in some of these cases, they will be complaints where someone in the back of the restaurant in a non-public facing area wasn't wearing a mask. Well, that's actually not covered in EO. So there are elements but even when there are multiples, I do think it's important to acknowledge that at its whole, we need to approach this from a win-win situation. And I think and that's why when we approach it, we are trying our best to approach it from a partnership situation, because nobody wants the economic consequences of shutting everything down again. And we can only get there if we work there together. So I will acknowledge again that a lot of these businesses are not public health experts. They have never had to mask. They have never had to do this before. And I think it's important that we continue to work with them and partner with them, but back it up, like when they were saying, like we were saying, back it up as we need to and as documented and as merited with further regulatory enforcement. But I would, as much as we can, we would like to pursue this from a partnership aspect. Mayor Stoney?
And I'll add that you've been to a number of these briefings right here. You know that public health is our number one priority right now. Above anything else, we want to make sure that people aren't sick and that they're alive, right? And I also recognize that this is none of us have ever done this before. The businesses who are involved right now, no one's ever done this. And so I'm grateful for VDH for stepping in and educating those who have received complaints. I believe they've been thorough as well. I don't believe there's folks out there who are, I haven't seen any or heard of any malicious intent to not comply, obviously. from what I've heard is, once the consultations has occurred, that compliance is then met. And I think that's a good thing. That's a good thing. I don't think there's any need at the moment to be any heavier handed than we've already been. And obviously, if there is a business that continually is out of compliance and does not adhere to the guidelines, and there should certainly be consequences.
Thank you very much, everybody. Appreciate you coming. We'll be putting out a release on the economic development. And if you have any questions, feel free to ask Leonard here or reach out to me later. Thank you so much.
Thank you, everyone. Stay safe, stay strong.